Hey, welcome to Health Source. I'm Dr. Doduro. We're going to be giving you a tour today, so come on in. First come in, this is our reception area. And this is Sarah behind the desk, our office manager.
Hi.
And we put some different sponsored companies that we work with. And this month it's Lifetime Fitness. It goes in conjunction with our Lifetime Wellness program we're doing this week. It's 10 steps to wellness. So you come out, most of the time you're going to be filling out your paperwork out here in the reception area. We're lucky enough, because I teach at Life University, that we have interns from Life that come and do their residency here, anywhere from 3 to 6 months. So we get to work with a lot of different specialties. Right now we have 2 great neuro students working with us, Brian and Matt, and you'll meet them a little later. Come on back. This area, step on in, is our patient education room. We kind of go over different issues. This gives out different information about the spine and how the body works. So it's constantly just going through different neat information. There are 90,000 taste buds on your tongue. So we go through different degeneration stages of the spine. This one's for the lumbar. We have our nerve chart over here that we talk about. People can kind of pinpoint where the areas they're having problems. And a lot of times people don't realize, but the brain sends messages down the spinal cord and out through these different nerve pathways. When everything's working well, you feel great, excellent health. Sometimes though you can get a bone out of place. We call it a mechanical stress to that area, or a subluxation that pinches on that area, the nerve or the artery, and it can cause problems. As chiropractors, we want to find those areas. We want to locate those subluxations or misalignments through our adjustments, put them back in place, and just allow your body to rebalance and heal itself. So come on out, we'll kind of check out the rest of the room. This is the back office for the doctors. We have a couple different, call them spinalators. You actually will lay face up on these tables and they roll and help kind of bring some flexibility or movement in the spine. It's really nice to get blood into the system and movement. It's kind of like a little warm-up before your adjustment. We have some private rooms. We do most of our exams right in here. Come right in. And with chiropractic, a lot of times people don't really understand what we do as chiropractors. And if we can get a good picture of this. This is a side view of the neck. And just like a bridge has that nice 60-degree arc in it to give it the infrastructure, we also want to see that side view in our neck. When we have that nice curve, most of the weight rests on these pillars. Okay? So it goes bone, disc, bone, disc. The disc should be opening to a V, like that. The brain sits up here, sends messages down into the top 2 bones called your brainstem. So it goes brain, brainstem, spinal cord. 3 different names, but they're all connected. You have the nerves and arteries that branch off and go to every cell, tissue, organ. So that's a nice one. Okay? Come on over here. We're going to show you a little x-ray of the side. This is one of our patients. She was our patient of the month, Miss Brown. And blue line shows where she should be. Red line shows where she's at. This is a before x-ray. And she was actually at 83% loss. Now, the vertebrae should be nice and smooth, like corners. And as you can see, as we get lower, they're almost like bone spurs or spurs on a boat, a cowboy boot. And those can be painful. She was having problems swallowing and moving. Now she's in her mid-40s, so that's not really a great spine. So she went through our program, and we're happy to say that over about 20 visits, she had 36% improvement. Blue line's where she should be, red line's where she's at. Now we can't go in and change the degenerative changes that have already happened, but we keep the spine healthy above and below those areas. So she's been doing great, and again, she was our patient of the month. We'll come into the next room over here, go down our hallway. We have x-ray down here on the left, and come on in. We process everything right here. come on over right over here. This is a great poster. When we're kind of going over x-rays with people, we want them to know this is the cervical region, it's the neck. There's 7 bones in the neck. This is the thoracic or mid-back. There's 12 vertebrae there. And then the lumbar, there's 5 vertebrae. And this shows what the normal should be in each area. And this is phase 1. It's when they've lost that normal position, the bones are out of place. It could be the thoracic spine or lumbar. Phase 2 is kind of like we saw with Miss Brown. She started to have the bone spurs, and phase 3 is where the bones are actually fusing together. Again, this is an area that is kind of past chiropractic. Let's go across the hallway. We're really lucky. We put a great wellness team together, and in this area over here we have a massage and acupuncture. It's a really relaxing room. We're lucky to have an acupuncturist that started with us, and we've had massage therapy for the last 2 years. So one-stop shop, and you can come in. We work with some nutritionists and some wellness coaching as well, so come on down this way. We help you find great personal trainers as well as you start changing your goals. This is a pretty neat machine. You might want to come over here, Matt, thanks. This is a DRX, it's a decompression. And this is for really bad patients, people who've had herniated discs or about to have had surgery, or people who've had surgery. Works well with osteoporosis, osteoporotic patients. And this, you'll get on it, and you're laying face up, and it stretches for anywhere from 20 to 27 minutes at a time. So it's really a neat advancement in our profession. Okay? Come on in here. This is where most of the adjustments are done. You can see we have a couple of our tables. It's a group open adjusting room. Nothing to hide. Just watch people get healthy. It's really fun. And people will get adjusted. Chiropractic has both manual adjustments, and we also have different instruments. I'm going to show you a couple. This is our vibrocussor. This is something that we work on. We can do 2 or 3 minutes with you with this, and it's like getting a 15-minute chair massage. We can kind of pressure point, kind of gets in on the muscle, helps vibrate. There's a lot of nice benefits right now to whole body vibration or general segments that we're working on. Okay? This, and there's different attachments that we can put on. This is an arthrostim, and we can work with this instrument to help create motion in the different vertebral bodies into the spine. So some areas, what happens is things get stuck. You get mechanical stresses that are locked up. And so maybe other than 5 cervical vertebrae that are supposed to be moving, only 3 are moving. We can kind of get in there gently and open it up. So it's not always that crack. And we have a lot of neat advancements that have happened in chiropractic. This helps reestablish the curve. We do some exercise and stretching over it. It's really neat. And if you can see over here, this is one of our functional rehab stations. Dr. Matt Antonucci and Dr. Brian Davis have been working with us. They're our interns right now. And this is kind of set up for, we're doing some posture and balance. We also have a natural treatment for ADHD. You can go to our website, ivyfallschiropractic.com, to see a little bit more about that program. We're really excited about that. Come on in here. This is our last area. And we have a couple different benches. This is a flexion distraction, helps create motion in the lower back. This is another form of lumbar traction. This table is pretty awesome because it will work with cervical traction too. If we have patients with real bad degeneration or arthritis in their neck. I also work at Life University, and I'm a co-director at the Functional Rehab Department. So we're working with this type of equipment every day, and we're getting great results. And we're also offering it here in Johns Creek. Okay? So thank you so much. I really appreciate you watching this short video, and we look forward to you giving us a call at 678-957-0266. Thank you.